And do you know what sort of processes they're trying to optimize for AI?
No.
Excellent.
You ask so many difficult questions.
full of detail. Welcome to Cloud Realities, a conversation show about what cloud-driven transformation really means for businesses and humans. I'm Dave Chapman.
And I'm Sjoukje.
This week we'll be talking about digital change in the healthcare sector. With new readily available technology such as wearables, along with leveraging the huge amounts of data that we collect in all processes these days, consumer experience as well as clinical and operations are all being impacted. Joining us this week to talk about this is Tony Ambrozie, Chief Digital and Information Officer at Baptist Health. Hey, Tony, how are you doing, man?
Good. Thank you for having me.
Great to see you and great to have you here. Maybe say a little bit about yourself.
So I joined Baptist about 2 years ago, coming from Disney, the Disney parks, and then before that from American Express. I have been driving a change and transformation using technologies and digital for a number of years. So it clearly coming to healthcare was, from that perspective, the interesting place to be and go. So.
Brilliant. Well, maybe we can start by, why don't you just tell us a little bit about Baptist Health, your company. What do they do and what attracted you to join and go on a transformation journey with them?
Of course. So Baptist Health is probably the largest health system, provider system, hospital system in South Florida. 12 hospitals and 26,000 employees, long established, long revered in the communities that we serve. And I came here, I was brought here 2 years ago to drive the digital transformation, to help drive the digital transformation. Baptist has been, the board, the executive committee have been thinking about digital and what it means and should mean for Baptist and its continuing mission to serve patients in the future.
Right. And what was their current thinking on cloud, for example, just as you joined?
Well, it was interesting because at that time, obviously, as in most of healthcare, cloud was not necessarily very well known or understood. I think there was more fear and doubt than uncertainty and doubt than anything else. So at the beginning, I heard, cloud will not work for us.
Right.
And I thought that's strange. How can it not be? But obviously, it was in the context of the larger transformation, digital transformation, where cloud has a big part in addition to all the other capabilities. And so now it's an integral part. We have started the migration of the capabilities that we had on-prem to the cloud about a year ago. I think we're 70% done maybe. It's a 2-year journey, and I think it's going very well for us.
And what was it about cloud that was concerning to the organization before you sort of unpacked it? Well,
I think it was more the unknown, frankly. And then, of course, there have been concerns about security or lack of security. But clearly, when we went through and we talked through, I think people understood the benefits. And as I said, we're on our way.
Well, let's talk about the benefits a little bit and talk about the structure of your business case before we get into the journey itself. So what was your business case predicated on? It can be sometimes difficult, I think, to set out a pure value case for a situation that is a little unknown. So where did you start? Did you start with cost?
Well, it's interesting. Yes. So this is my second cloud migration. In previous life, we've gone through that.
So you're like a veteran at this, Kate.
Well, I think
two tours.
2 tours of duty. Yes. It's interesting that for the technologists and the digital professionals, cloud is a lot more than just infrastructure, and is definitely a lot more than saving money. which it does, properly managed. However, in order to get the money for the migration, that's the focus of the proposal. Hey, we will save money. We compare what we spent today to what we would spend in the cloud for equal loads and increase over time. However, as we were saying earlier, for us, it's not the money, it's not just the infrastructure, but it's that entire ecosystem of capabilities that cloud providers have, and you can just get them, as they come, and not necessarily having to reinvent all that management or the tooling or the marketplace that these providers have. But you start with really with the money, because that's what gets things going. And then it's interesting how you have to build that case. Migrating to the cloud is not cheap necessarily, but what we did, we looked at over 5 years. How much was the cost of the on-prem or our data center, the need to refresh technologies all the time, the need to automate and to invest in automation tools. And then we looked at, as I said, the equivalent over 5 years of the cloud with the expected growth in both places. And I think what we've seen is a pretty substantial cost reduction from that perspective.
I mean, that's terrific to hear, because a lot of people struggle to get, cost savings when they moved to the cloud. And my perspective is, well, if you were moving from a really slick, very high utilized environment into the cloud, then you might struggle with it a little bit, particularly if you don't get your head around FinOps. What was the secret sauce for you and your context?
Well, you're right. You're absolutely right. If you come from a very well modern data center that it's densely populated, therefore you get the value lower per unit of computing.
Yeah,
it is a little bit more complex. We had a relatively large data center. That was not particularly well utilized from that perspective. We're not talking about 80 to 90% utilization or the data center being full.
Yeah.
Plus, it needed in the coming years a number of investments in uplifting automation, and I think the case was easier to be made here. Yeah, as I said, even in a previous life, the case was still there. It wasn't as good, but it's still very positive for the migration. Now, one thing that, yes, it depends on what type of capabilities or loads you have, but costs can go up if they're not controlled. Of course, if you have a bunch of developers starting instances and buying things from the marketplace without controls, it could get expensive very easily.
Yeah.
But there are so many processes and tools and expertise to make sure that all the time you're optimized. Whatever you have bought or used, it's optimized to what you really need, and that helps immensely. And to their credit, I think, at least the AWS that I know of, they make it. They're supporting this. They have tools, and they provide help to reduce the cost.
My perspective on not realizing cost saving on the other side of the transformation, depending on the aforementioned context, is maybe they haven't got mature FinOps processes in place. So exactly to your point, if it's left unguarded, then costs can run up. But you must have brought some experience to that conversation.
Absolutely. And as I said, to their credit, even if we didn't know about it in the first go, Amazon or AWS, they tell you, hey, this is how you optimize. These are the tools. Can we help you? I think their business case is through volume, not through consumers or customers using a lot more things versus inefficiency or unit prices.
Did they also support it with the actual migration?
Absolutely. As much as we needed, absolutely. They've been. We have a great account team from them, and very very supportive, and providing whatever we needed. Yes.
Okay, that sounds good.
They've been through this journey, 100,000 times, so
Yeah.
they're pretty good at it.
Yeah.
So you've set yourself up nicely. You've got yourself a business case that's kind of got a robust underpinning from a financial perspective. You're on the journey. Now let's just take a little bit of a step back and talk about the business context within which you were operating. So tell us a little bit about the US healthcare market as was present at the point you were making some of these decisions. What was going on?
Well, I think healthcare, probably across the world, definitely in the United States, has been behind in terms of technology and digital for quite a while. So
Which is a little ironic given things like wearables and
absolutely,
kind of personal technology is really in that space, isn't it?
and then that's true. But I think the focus had been elsewhere and maybe high acuity areas. But even on the technology side, I think somewhat behind across the board, and that's the context. So part of what folks like me are trying to do is to basically raise that bar across the board, and frankly, catch up with the world, so to speak. Both from a technology perspective, but also from a consumer capabilities perspective, because in that space, the consumers don't judge us necessarily, or individual hospitals comparing to other hospitals. They judge us comparing to their other digital experiences,
right.
So you have to compete with how easy it is to shop on Amazon, or on Disney, or what have you. So there is a element of catching up, frankly, that we're well on our way for that.
And I think you described the situation in the healthcare system at that point as a bit of a perfect storm. I wonder if you can just unpack what you meant by that.
Oh, absolutely. I think it started with it became obvious with the pandemic, and it was a terrible tragedy. Very stressing, very demanding on healthcare across the world, on all systems, on the individuals, the healthcare providers themselves, the nurses and the doctors. And then after that, as we were coming out, then we're encountering, all of us, this issue with inflation everywhere, so that's number two. But also is the consumer expectations being a lot higher, especially during the during the pandemic. A lot of consumers have been using digital experiences to great results. Now the expectations are much higher. Which is something that started before the pandemic, but I think it's accelerated. There is an expectation of being able to find, being able to book, being able to check in, being able to have telehealth that did require a lot of transformation and technology and digital, which in turn requires things like the cloud, AI and ML, and so on and so forth.
So as you were looking then at Baptist specific business transformation elements, what are the core technologies and experience changes that you wanted to make in your organization?
Definitely focusing on, especially on the digital experience side, focusing on those experiences for consumers. And usually they're called front door, and I really don't like that, because it's a the wrong paradigm, mental model, if you want. But everything that the patient needs to have access to the care, and have access to their information in the most effective way, that has been the core focus at the beginning. And then moving to the next area is really about improving the experience for providers as much as possible through using technologies and digital experiences. How do we make things better for those? that use the internal systems. And it's just to say a variety of things. Some of it is really helping transform some of the processes that we have, which is always difficult. Others is based on thought through product management, introducing new capabilities or new tools.
Right, so it's a real end-to-end ecosystem play rather than purely a consumer experience play.
Absolutely has to be. And then by the way, there's a third part, which is really the operations, looking at the operations, because they all come together. Now, when you start, you have to start somewhere. Then, we started, on the consumer side, but clearly also on the other two parts providers and operations. And now as the consumer part is, I think, going very well, now focusing more on the clinical provider experience and the things in operations or administration or what have you. Because they do come together. They work together. The patient having better access in the providers being able to provide more care or simpler ways, and then with the operations providing the kind of underlying support for both of those to happen. And as I always say, is if we can make things easier and better, we can provide more care and sooner, and that's good for patients.
Absolutely. And are you also within the right regulatory framework, of course, harvesting data that might improve clinical outputs eventually?
We are looking at that. To be very clear, we're not selling data. There's just no way. No. Where there is, obviously it's there are protections, but even beyond that, it would be not the right thing for us to do. But clearly mining the data in order to provide better care, in whether it's purely clinical or purely medical, or maybe as a way to understand and make our operations more efficient. Absolutely, that's something that, the people say, the data is the new oil, but in order to get the oil into gasoline into our tanks, there's all those infrastructure that needs to be created.
Yeah, maybe just to bring our conversation today to a bit of a conclusion, I'm interested in what you did with your IT organization, because you've obviously gone through a huge technical change, which is giving you the platform on which you can deliver these new experiences and new back-end optimizations. What impact did it have on your IT organization, and how did you negotiate that change?
And so, first of all, this is still ongoing. We're 2 years and probably in a 5-year transformation. And even that is a little bit misleading, because these things are not projects with a start and an end.
Yeah.
And then in like 5 years, we finish the digital transformation and we're done. Obviously, as I said, we're catching up, and then we're going to start evolving.
I always think the behaviors and the way that you end up working during the transformation is the way that you will end up working post the transformation, the sense of sort of iterative discovery.
That's exactly right. That's a great point. However, sometimes that is missed, and everybody looks at this is the change during the transformation process, but then we go back to
how we did it before,
not having to change. So we haven't learned. We're not learning that we need how to change all the time and regularly. So it's still a definitely a process. There's so much to do and so much we can do. That's part of what attracted me to healthcare in the first place, by the way, which is there's so much opportunity. And, as a patient myself, I see the opportunities, and it's very clear to me that, hey, there are so many things that we could do. I know we can do them, and we are doing them. And that was the attraction for me.
Do you have an example so far on your journey that you're particularly pleased about, whether it be to do with the cloud transformation and the cost reduction, or whether it be to do with a new experience delivered that you could share with us?
I think, clearly these things are not easy for anybody. There's a lot of investment that needs to be made, and a lot of change, and a lot of hard work involved. Yes, cloud is definitely something that we're very pleased, not just because of the money, frankly, but because of the things that now we can do, and it's so much easier and frankly sometimes the only way to do things. And I'm very very happy with how we're progressing on the consumer digital capabilities, and I think that's great work there. And we're making progress in AI ML. And we started there really not on the clinical side, so not on the medical side. That's I think a lot more complex and complicated. But we started with things that we can apply models to operations that frankly are very similar to things that have been done by others outside, even by myself or ourselves, in previous lives. Optimizing a process through ML is something that we've been doing for a while. So therefore, we started there, and I'm pleased with the progress there. But again, there's so much more to be done. It's a work in progress.
Sjoukje, what's trending this week?
Every week, I will do some research on the recent tech innovations and pick one that I find interesting to share with you. And this week's innovation is about the UK government, because they launched a £1.5 million program to support the use of AI to reduce carbon emissions. And that AI for Decarbonisation program is part of the wider 1 billion net zero innovation portfolio. And this program aims to accelerate the commercialization of low carbon technologies and business models. So the AI for Decarbonisation will consist of 2 initial stages. The first stage will provide up to £500,000 of funds to create a virtual centre of excellence on AI innovation and decarbonisation through March 2025. And stage 2 is where the remaining £1 million will be used to fund innovative AI-powered decarbonisation projects. So the UK is really seeking to increase its energy independence following Russia's invasion of Ukraine and the weaponization of supplies.
So do you know what the underlying AIs that they're using? So like, what exactly are they doing? Do you know?
No, that's not really clear, but they are really looking for new projects to be funded to really work on these types of projects or types of challenges, to be honest. Yeah. Basically, it's a fund. If you have a good project that you want to build or something that you want to invest on, you can use that fund of the UK government.
Are they looking for anybody to sort of pitch in and apply to that fund to be able to use technology to drive the decarbonisation effort?
Yeah, they're really looking for projects to bid for funding. Yeah. So the new energy infrastructure to increase supply will take a long time to build. So reducing demand in the meantime is extremely important. And 2 leading solutions to that are improving the installation of homes and businesses and using technologies like AI to optimize the processes.
Yeah, they've been doing that whole insulating houses thing for quite a while, haven't they? I wonder how AI is actually going to improve that.
That is very difficult to say at this moment because the amount of information for this project is still very limited. But let's hope that we will find out in the upcoming period if there is any news around this.
All right. Okay, we like to end each show by asking our guest what they're excited about doing next. So, Tony, what are you excited about doing next? Are you excited? It could be anything from I'm looking forward to, walking the dog all the way through to a big next phase of your transformation program.
Well, I think so. I mentioned earlier, we're in a phase that really is, I call foundational, and still in terms of for consumer, for patients. Access, a lot of it is about access to information, to care. But I think the next generation of our transformation will be around all those things that we can do to improve their health, not just provide healthcare, improve their health even in between the interactions that we have, the encounters, the visits to our doctors.
So would that be the sort of thing where you're trying to encourage healthy lifestyles and monitoring and things like that?
That's exactly right. So you were mentioning earlier, very early on, about sensors. There is so much now becoming available. Clearly all of us, well, some of us at least, have the Apple Watch, and then there's a wealth of information coming from there. But the other things that and that kind of they stay with us 24 hours a day. And how do we harness that to provide as much as possible, a better the ability for consumers and patients to manage their health better.
Amazing. And when do you think, is it too early to say when you might be getting that to market?
Probably we still have some catch up to do, but we always the way I like to do things is start somewhere small and then evolve as much as possible. And frankly is all of us are getting old. At least I am getting more older.
Amen. And me too.
Yes, and therefore I look for those things that I would want to have in terms of supporting my health and my well-being, permanently or constantly.
Indeed. Well, we'll look forward to seeing that greatly. And many thanks for your time today and for the insights that you've given us into your process and transformation. We wish you the very best of luck with it.
Well, thank you. I appreciate it.
So a huge thanks to our guest this week. Tony, thank you so much for being on the show with us. To our sound and editing wizard, Ben, and of course to all of our listeners. So we are on LinkedIn and Twitter, Dave Chapman and Sjoukje. Feel free to follow or connect with us and let us know if you have any ideas for the show. And of course, if you haven't already done that, rate and subscribe to our podcast. See you in another reality next week.